One of the questions that you can easily miss on the NCLEX is substance abuse. Do you want to know how to answer questions on substance abuse? Stick around. By the end of this video, you will know how to approach them. I'm going to link a video to help you with the content, but 10 questions showing you how to answer them straightforward. Don't memorize the signs and symptoms. There's an easy way to master them. Stick around. Let's get it done. This is the first question. As usual, stop the video, attempt to answer the questions on your own. But this is a next generation form of substance abuse. And let's evaluate a client with the following symptoms. Identify whether they are expected with what? Stimulant intoxication. That's the buzzword. Dilated pupil, hypotension, hypothermia, agitation, severe sedation. Like I said, one of the common questions that you can miss on the NCLEX is substance abuse because of what? The symptoms they're going to give you look really bad and you want to pick it, but don't pick it. Pick the answer on your own and then I'll give you the explanation. But this is how you break down the content. Go back to the question. There's going to be a big word. Identify whether this is an expected finding of what? Stimulant intoxication. That means you're taking a stimulant overdose. It's the same thing. They can change the word. Stimulant intoxication is stimulant overdose. You're looking for symptoms. Then the next thing you have to tell yourself, a stimulant is the same thing as what? Sympathetic nervous system. So they stimulate the sympathetic nervous system. Therefore, what you care about is sympathetic nervous system stimulation. That means if you stimulate your sympathetic nervous system, what are you going to see? Everything is going to go up. That's all. Don't memorize any particular symptoms. If you do that, that's a trap. You're about to lose that question. Therefore, if everything is going to go up because I'm stimulating the sympathetic nervous system, my pupil get bigger. When you are stimulated with your sympathetic nervous system, you want to run away. Your pupil get bigger and bigger so that you can see far away. Expected finding. Your blood pressure goes up. It does not go down. Hypotension, don't pick it. It's a trap. Not expected. Hypothermia, right? Your temperature goes up. Sweaty, diaphoresis, expected finding. You get what? Agitated because of what? Sympathetic stimulation, expected finding. Severe sedation, you want to pick it because sedation is bad. No, that is no stimulant. That is what? Something that depresses you. Therefore, this is not expected. First clue, use that strategy every time you see a question on the stimulant that stimulates your central nervous system, that stimulates your sympathetic nervous system. This is the right answer. And this is the key I give you. NCLEX trick, everything goes up. When it comes to stimulant, that's the key. Therefore, the opposite, any downer, everything goes down. Same strategy. Which of the following findings should the nurse suspect in the client the first 24 hours? Withdrawal. That's the key. These are the words you should look for, not the signs and symptoms you want to memorize when you're studying about substance abuse. A nurse is caring for a client admitted for what? Alcohol withdrawal. Which of these should you see? Bradycardia, tremors and diaphoresis, severe hypotension, respiratory depression. I told you the signs and symptoms will look really bad. You don't know which one to pick, but don't let them trap you. Focus on the keyword in the question. Like Adapt NCLEX, if you watch my video, you will master how to approach questions, not memorizing signs and symptoms. The keyword is what? Alcohol withdrawal. That's the buzzword. Alcohol withdrawal. And alcohol is not a stimulant. What is it? It's a downer. It depresses you. So a depressive symptoms is alcohol intoxication. So when I take alcohol and I'm intoxicated with alcohol, my symptoms is supposed to go down. If I don't have alcohol, my symptoms will now go up. Therefore, if I don't have alcohol, I'm withdrawing. If I'm withdrawing, my symptoms are going up. Which of this is going up? Bradycardia, you're going down. Tremor and diaphoresis, you're going up. Severe hypotension, you're going down. Respiratory depression, you're going down. You can see when you do that, you will never be trapped with these big words. That's your key. And that's the signs and symptoms you should expect. Number 3, and this is assessing a client who has a history of what? Opioid use disorder and has not used opioid for 24 hours. Once again, these are the ways you look for. The keyword in the question already answered. Which of the following indicate opioid withdrawal? The same thing, I just give you another point to use, opioid withdrawal, but I could have taken all the opioid withdrawal there and I said, which of these should you expect? I already told you, patient use opioid and he has not used it for 12 hours. That's the signs and symptoms of what you're looking for, withdrawal. If you take opioid is like alcohol, depresses you. Therefore, if you don't have opioid, you go up. Therefore, I'm looking for upgoing symptoms. Constricted people, I'm going down. Constipation, I'm going down. If I have diarrhea and my muscle aching, everything is going up. If you have respiratory depression, I'm going down. Therefore, what do you think is the right answer? Number 3. You see, if you do that, 3 questions, you ace it. Which of the following statements by the client indicate understanding of the teaching about what? And this is providing teaching to a client prescribed Disulfiram for the treatment of alcohol use disorder. Which of these indicate correct understanding? I can drink small amount of alcohol while taking this medication. The medication will reduce alcohol cravings. I will avoid products that contain alcohol. I should take this medication only if I feel the urge to drink. Key concept. Whenever you see Disulfiram, I want you to write this down. People get confused with Disulfiram and benzos. Disulfiram for alcohol use disorder is what? This is a deterrent. If I give it to you, if you go to a rehab, we give you this so that you don't drink alcohol. If you drink alcohol, you get sick. That's the answer choice. It's not used to decrease your craving. That's not the opiate. That's not the benzos. This is to prevent you from drinking. If you drink it, you're going to hate yourself. Therefore, what do you think is the right answer? Anything that contains alcohol, you should avoid it. Lavender, whatever, don't even put on your skin. Even hand sanitizers, you should avoid it. That's the key. Number 5, what is your score so far? Like I said, stop the video, answer the question on your own so that you can master everything regarding substance abuse. It does not matter what they give you. So far as you have the foundation, the strategy to approach the question, and which of the following findings should the nurse suspect and nurse is caring for a client arrive at the emergency room after using what? Cocaine. Now you got to identify what is cocaine. Is cocaine a stimulant or cocaine a depressant, right? Do you expect bradycardia, hypertension, agitation, constricted people, and sedation? If you put it in the group, you know that cocaine will do what? It's a stimulant. If you have a stimulant and you take it, what is going to happen to you? You're going to be going up because it's a stimulant. You're going to know there's not going to be any bradycardia when you withdrawing from that. Your people constricting when you're withdrawing from that. Sedation when you're withdrawing from that. But when you take in cocaine, hypertension, agitation, because that's the same thing as what? Intoxication. Look for that word. Intoxication, withdrawal. You have not taken. Those are the words you look in the question. And this is caring for a client experiencing delirium tremor from alcohol withdrawal because they have what? Downer is alcohol. If you withdraw, you're going to have seizures. That's delirium tremor. Which of the following medications should the nurse anticipate? If you're going to have seizures, this is the strategy. Naloxone, lorazepam, methadone, flumazenil. This is a strategy I'm going to give you. I want you to write it down. Stop the video. You take alcohol. It's a depressant. If you don't have it, you develop what? Seizures. Why? Because when you're withdrawing, things goes up. That's why you're having seizures. You become hyper. What can we do for you? Bring you down. Therefore, pick a medication that will bring the individual down. You pick a downer, something that will bring them down. What will you give to the patient? Naloxone is used for what? Opioid, what? Antidote, right? If you have too much opioid on board, we give you naloxone. Flumazenil, if you have overdose of what? Benzos, we give it to you. Methadone, if you use opiate for a long time and you need something to help you, this is what we give it to you. Lorazepam is going to put you down because it's what? Depressant. This is the key. Therefore, it's used for what? DT. And this is assessing the client suspected of what? Benzos overdose. I've given you the clue for this already. If you take too much benzos, what is the antidote that we're going to give it to you? Naloxone, Flumazenil, Disulfiram, and Methadone. You've seen all this medication. You just have to know what it is. Naloxone is used for opiate. Flumazenil is for benzos. Disulfiram is used to deter you from drinking alcohol, and Methadone is for opiate. Therefore, this is your right answer. NS is providing teaching to a client who taking what? Nicotine replacement therapy using a patch. Which of the following should you include? Apply the patch to the same site. Cut the patch in half if it's too long. Smoke cigarette while wearing the patch. And remove the patch before you go to bed if you have insomnia. What do you think? Pick your answer, let me know. But I can tell you, one is wrong. You should not put the patch at the same place, even if you don't know. You should not manipulate the patch. Don't cut it into pieces. You should not smoke if you're on nicotine replacement, overdose. Therefore, by default, that the patch usually give you vivid dreams. Therefore, you're supposed to take it out before you go to bed. That's the key. Number 9, same strategy. We're back to substance abuse keywords again. And this is assessing a client experiencing alcohol withdrawal. A downer, if you don't have it, you withdraw. Your symptoms is supposed to do what? Think about it. Which of the following findings should the nurse suspect? Selected apply. Tremor, bradycardia, hallucination, dry skin, pinpointed pupil. Like I said, you're going to see bad symptoms. They will trap you to pick it. Based on your content, stand your ground and pick the right answer because of what you know. Don't over-select. Break down the question. Alcohol withdrawal. Alcohol is a downer. If you take in, you're going to go down. If you don't have it, that's a withdrawal. You go up. Therefore, what signs and symptoms are you looking for? Up, up, up. Tremor, I'm going up, up, up. Bradycardia, I'm going down, down, down. Hallucination, I'm going up, up, up. Dry skin, I'm going down, down, down. Pinpoint people, I'm going down, down, down. You see? Keep on singing. You get 2 answers right. And you don't over-select. Excellent. And the last question. NS is providing care for a client who take what? Cocaine regularly. He arrived with what? Agitation. That means he took in some cocaine. He has hypertension. Everything is going up. He has tachycardia. He's sweaty. What do you think? Things are going to go up. What should you expect? You don't even have to overthink it. I said, if you take cocaine, your things are going to go up. Stroke, hypoglycemia, respiratory depression, and hypothermia. Which symptoms are going up? Hypothermia, I'm going down. Respiratory depression, I'm going down. Hypoglycemia, I'm going down. Common sense, stroke, you're going up. And then you lose your consciousness. This is the key. 10 questions. NCLEX practice question. NCLEX review questions on substance abuse, mental health, psych, pharmacology. I'm going to link a video that will show up on the content regarding this. Watch it. You master this. If this video helped you learn something today, just click on the like button, put a small comment, and thank you for watching. Good luck.